Statistical significance versus clinical significance. A group representation from Group 1, conducted by Gemma Viray, Fidelia Nita, and Desiree Que-Olan. Statistical significance helps determine the level of probability whether the data results presented by a research are caused by chance or not. If research findings are deemed to be statistically significant, this means then that there's a very low probability and it only happened by chance. If they're deemed to be statistically insignificant, then it means it's the other way around. Statistical significance is important as it allows us health workers to determine whether the data results of a research are valid and reliable or not. It also tells a lot about the weakness or strength of the data used for the research and the confidence the researchers have in their findings. This way, we can first determine if a research is good and representative of its target population before considering its clinical significance. Clinical significance is also important as it allows us healthcare workers to determine if the data results of a research are really useful in a clinical setting or not. It also allows us to decide if the data results are applicable on a particular patient or if they can improve treatment effects. Okay, so now we need to take a look at this example. An oxygen saturation difference is related to patients' body positions. There is a difference result of mean saturation for supine position 96% and sitting position to 99%. On this given example, clinician or nurses needs to consider if the intervention was cost-effective or beneficial to a specific population. If the intervention was not cost-effective or beneficial, then it may not be clinically significant, even if it has a statistical significant value of 3% or a p-value of 0.05. A result is clinically significant if it is big enough to make a difference in the treatment that we give to a patient or to a client. It is also depending on a few individual factors, such as if the intervention is cost-effective, as well as if we're going towards the patient's goals or preferences. A calculated value from a sample performed by a researcher usually represents the estimation of the value from the actual population. The estimation on the differences from the two samples is called the p-value, which is a significant value of less than or equal to 0.05. By that being said, statistical and clinical significance should be considered in improving best patient outcomes.